Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, and Dr. Ronald Schwartz, our Senior Director for Continuum Health Services. We're checking in with you once again as we all work together to help prevent the spread of coronavirus. Dr. Schwartz, the news about a fast-spreading COVID variant and the effect it's having in other countries has many people feeling uneasy. What have you learned about this?
Well, again, an excellent question, Sandy, and I think an excellent topic. And maybe I should start like this. When you listen to the news or you listen to different information, you want to be sure that the information you get is from very reliable sources because, COVID, as you know, is covered by all kinds of media and press and so forth. And, as part of what I do, we talked about before, I participate in the coronavirus task force as well as the vaccine distribution task force. And I'm very proud to be part of these committees. But one of the tasks that we have and what we do is we keep abreast of the latest developments through the CDC, and that stands for Center for Disease Control. So I use this as one of the roadmaps, so to speak, to really get the information that I rely upon. So I'm going to talk to you just a little bit about, again, something we talked about maybe a few weeks before, and that is what type of virus is the COVID virus. And you may remember I talked about viruses being two main types, DNA and RNA. And RNA viruses mutate. It's just something they do. And one of the types of viruses you're probably familiar with is the flu virus. The flu virus is an RNA type of virus. And you might find it interesting that the term corona, the actual term corona is a crown. And the reason that they call this a coronavirus, it's named for the crown-like spikes on the virus. And these are the spikes that tend to mutate, and they have different characteristics, the types of characteristics that scientists monitor closely for any kind of changes. So what have we seen? And this is based on CDC guidelines, and I do have a little information that I myself researched because it is important. And this is pretty much fresh from the CDC webpage. But what they've found is that there are multiple COVID-19 variants that are circulating globally. So you probably, from watching the news, know that in the United Kingdom, there's a new variant that emerged, and there's a large number of mutations. And from what they were saying, that this variant seemed to spread more easily and quickly than other variants. But the real point, and this is what I wanted to emphasize, what they're writing here in the CDC, and I'll read it to you. Currently, there is no evidence that it causes more severe illness or increased risk of death. And it has been seen in other countries, including the United States, but I want to emphasize that statement from the CDC. So we've also seen separate variants from the variant you see in the United Kingdom, in South Africa, and in Nigeria. But again, the statement here from the CDC is there is no evidence to indicate that the variant is causing any more severe or increased spread of COVID-19 compared to the non-mutated strain. So this statement that I'm reading from is divided into two main parts from the CDC. And the parts are, first, what we know, and that's what I read to you. And the second is what we do not know. And you're not going to know everything because it's an evolving science and an evolving process. So like many things in medicine, most things, more studies really are needed to understand, what's happening, such as how widely the new variants have spread, how they differ, and how the new variants differ from disease caused by other variants. So what they're really looking at, and public health officials from the CDC, they're trying to see if it's spread more easily from person to person, if it causes a milder or more severe disease in people, if they can still be detected by our currently available viral tests, if they respond to medications that we've been using to treat COVID-19. And I think this is the point that I want to emphasize the most, and I think the CDC did as well, a lot of the questions come up. Does it change the effectiveness of COVID-19 vaccines? And the statement I wanted to read to you, which is what I go by, is there is no evidence that that's occurring, and most experts believe that it's unlikely to change the effectiveness of the vaccines because of the nature of the immune response to the virus. And even if the virus mutates, which an RNA virus will do, it's still an RNA virus. So that's what I'm trying to emphasize to you. So what's the final point I'm trying to get at today? It's that get vaccinated. It's important still to get vaccinated. It's one way to fight this pandemic. Hand washing, social distancing, wearing masks, avoiding large crowds, and still avoiding travel. So by now, those of you who've watched this segment know I try to come up with an inspirational quote every week that kind of drives home my point. So this one comes from T.S. Eliot, actually. And it says, "For last year's words belong to last year's language, and next year's words await another voice." So I thought that was appropriate, this being the first presentation that we're doing in the new year, and to hope that, with the vaccine, with following all the protocols that we talked about, last year's words will be passed. And we have a new language this year in the words of fighting this pandemic together and keeping ourselves and our residents safe. So with all of that, I just want to say Happy New Year, and I wish you all peace.
Thank you so much, Dr. Schwartz, for all of your insight and the beautiful words that you always pass along to all of us. And JP, as of now, where do we stand with vaccinations for our staff and residents?
So, Sandy, first, Happy New Year to you and everyone watching this video. I will say that 2021 brings light at the end of the tunnel from our perspective, and the vaccine is a part of getting us to that light. As far as the vaccine, we've actually done very well so far with our nursing home and our assisted living here in Wallingford. And next week, we will actually be having our second shots for those that had just gotten them a little more than 2 weeks ago. With that being said, the rest of our assisted livings and our residential living communities are actually slated to get their first shot sometime this month. So pretty much all of our communities and all of the assisted living partnerships that we work with have gotten dates for this month. So we're actually very excited to have two things. First, many of our staff and residents in our nursing home and our assisted living here in Wallingford will get their second shot. But then many of our assisted living, independent living, and our staff will get their first shot in the rest of our organization. So January is turning out to be a very busy month, but also a month where we will see the majority of our residents and staff have the opportunity for the vaccine. So I'm extremely excited because I think this helps us in getting through that tunnel to that light. And I think over the coming months, you're going to see really the rest of the state of Connecticut start to get that vaccine out. So we are extremely excited. We're happy that this will happen, but it will not change us wearing our masks, as Dr. Schwartz said earlier. Wearing our masks, social distancing, and large crowds are all things we're going to have to be accustomed to for the coming months, definitely. And I just implore everybody to be vigilant in doing that because it's going to take us a while to get through this.
Absolutely. Stay the course is the words we've been saying.
Yes.
Well, thank you both so much for sharing your time and all of this important information with us today. And thank you for watching at home. We wish you a very happy and healthy new year. Until we see you next time, stay safe and stay well.